So we know that there's something going on in the heart there. We need to explore that a bit more. And with that, what else do you guys want to do? Okay.
They say focus, yeah.
So cardiology, it's overnight. They're really busy in the PICU, so they can't come down and do the echo. Classic. But Jordan is working, and he knows how to use point of care ultrasound. So he comes and he helps me out with this. And so it's a little bit of a grainy image, and it doesn't project the greatest. So I'm just going to kind of write this out for you guys real quick.
So you look at this image and you see maybe a little bit of a pericardial effusion, maybe just a little bit of fluid around there. But overall, it's not terrible. The ventricles look approximately the same size. The septum looks a little funny though. You know, that septum on the right, it's kind of bowing in to the left maybe.
And think about it, does that make sense? Like, what side of your heart is undergoing the most pressure when it squeezes and pushes blood out? Usually it's your left side. So if you were thinking the left side is facing, your systemic blood pressure, you would expect that the wall that's shared between the right and the left side of the heart should be bowing into the right side. But when Jordan's doing this and he's looking at it, he's like, that's weird. Why is the right side bowing into the left? It's the opposite of what he's expecting. Maybe his settings are wrong and this is just backwards and he's got the chambers wrong. But that's not what the case was. That happens to me frequently. Something's wrong, and then it's not. I've got it backwards. But in this case, this is accurate. The right ventricle is bowing into the left, which means it's trying to squeeze and contract under higher pressure, which then actually fits with what you're saying there. That maybe that there's a PE, maybe the fever part is related to a strep and endocarditis, and it fits with the ECG as well, given that we saw that there was a PE-type pattern of strain with right-sided heart strain as well. And then she's got this fever with a super high CRP. Maybe this is all fitting really well. But her rapid strep is negative. It's not totally accurate, but I'll tell you she doesn't have strep throat. But that's a good diagnosis to think about. And this is just going over what I just explained, that the right ventricle is much larger than the left. That's not what we're expecting. But it tells us something is wrong. What else should we do? This girl's now becoming unwell. Because if it's a PE, we're wondering, like, does she need to go to some sort of surgical intervention? Does she need thrombolytic? Like, what is actually happening? So now we need to start acting a little bit faster because there's some decisions to be made. And she's progressively becoming more unwell. And now the mom's concerned. So yes, this is not an anxiety attack. The mom's now totally bought into that she's sick. What do you guys want to do next? CT scan.
Perfect.
So what do you see in the CT scan here? I mean, I'm no radiologist, so when I look at these scans, the body's fairly symmetrical in nature. So I take one side, compare it to the other side, and I try to see if there's anything that I'm noticing that's off or abnormal. Do you guys notice anything?
What do you guys see? Who wants to be brave and circle something? You look like you want to circle something. Definitely. That
Yes.
looks weird.
So there's something going on there. Is that a consolidative process? Is that a PE that we're seeing there? But it's got this weird sort of like infectious gunky pattern to it, and not just like a classic PE type look. There's something going on there, so totally. And because we saw this on the CT of the chest, our clever radiologist said, Devin, I just want to extend the CT up to the neck, because you're telling me that this girl has neck pain, fevers, and now this query PE, but not looking like a PE type thing in the chest. Sure, do it. Sounds good. This is what we see. Now again, this is really tricky, because even though I haven't been necessarily trained to look at this, but the body is symmetrical. So if you take a look, there's something on the right that's filled that's not there on the left. And this is a contrast CT scan. So we're expecting vessels to be lighting up really bright white. Does anyone notice anything that's a bit different or a bit off here? I'm seeing nods. I'm seeing nods for this gentleman. Maybe he can point it to us. Yeah, so that's lit up really bright and white. And with a contrast CT scan, we kind of expect that to light up. And so what we're noticing is that why is it not there on the other side? There's definitely something wrong. And so what that would be indicative of is a filling deficit.
Yeah.
Yes, you've noticed that as well, which is very good. I'm not going to go into explaining that because it's really complicated. I'm not a radiologist, and I didn't lie to you what that is. But as you saw, this is filling really nicely here. This should be filling here. So this is your internal jugular vein. It's filled nicely with contrast. For some reason, on this side, it's not filling. There's a deficit there. And this would be in keeping with someone who has a clot in their jugular vein. So now if you step back, the radiologist is telling me, you've got maybe some sort of PE infectious-looking process going on in the lungs. There is a clot in the neck, and then you step back even further. She's got some right-sided heart strain. She's a really high CRP, a history of throat pain. She's a previously well-teenage girl. And this all points to a not uncommon and very dangerous diagnosis that we see sometimes at kids a couple times a year. And it's the classic presentation of a teenager, throat pain, amoxicillin. Comes back, ongoing throat pain, more amoxicillin. And then it comes back a little bit further, EBV is negative, and now they become really unwell. And this is what this girl had. And this one particular diagnosis. Can anyone think of it? It's super rare.
Read my mind.
Yeah, read my mind. It's something called Lemierre's syndrome. And Lemierre's syndrome presents just like how I explained it. Adolescents who have this, previously well, they've got a bit of a sore throat, they're complaining of some neck pain, and the symptoms keep getting worse and worse and worse, and it doesn't quite fit, like something's just off. Why would she not be responding to amoxicillin multiple times? And what ends up happening is that throat infection leads to a thrombophlebitis in the internal jugular vein, which leads to a clot. And then that clot just starts throwing off septic emboli. So when we talked about a neurological exam, sometimes these kids present with fever and neurological features. And then we get really thrown off because we're thinking, is this like an encephalitis or a meningitis? Sometimes they just present with this tachypnea and a PE type set of symptoms and features, which is what she presented with. It's a very tricky diagnosis to make, but it's also a very important one. This girl, well, let's just go to this step. Where would you guys do? What would you do with this girl?
Treat her for a septic shock and then chase PICU once you.
Yeah, send her to the PICU. I mean, for some reason, we sent her to peds. It's just our threshold for PICU at SICK is very, very, very high. And she'd actually responded really well to fluid boluses. And I think it was a huge mistake, although she did really well in the end. And the reason why it was a bit of a mistake is because on the pediatric floor, she then threw another clot, and that clot caused her to arrest. And so she had a code on the floor, went to the PICU. It would have happened if she was in the PICU as well. It's just she would have been there already. Our rapid responses are very fast, so she ended up on ECMO for 2 weeks, actually, and then made a full recovery, and is now totally well and fine. But I think the point of that disposition piece, and a point to myself to always remember, is when you don't feel like you have control of the direction of which way a patient is going, you should usually err on the side of sort of putting them in the place that has the most resources. So we made the diagnosis. We knew that she was throwing clots off. When you think about it, even though we started antibiotics, I can't control that another clot's not going to fire off. And so she did well in the end, but I think in retrospect, I would definitely push much harder and have sent her to the PICU. All right, and I think we're almost out of time. So maybe what I'll do is I'll introduce one thing very quickly. There's another case here that we're going to put up on the website. And the website, I will take you to in a second, is at pemnetwork.ca/PACE. And if you go to this website, what you'll see is a whole collection of pediatric emergency medicine-based sort of initiatives. We've decided, again, in our emergency department that focusing on physician-assisted pediatric education will be a priority. So it keeps a nice pace on the webpage here. Yeah. This is the website that you go to called PACE. There's a countdown to every live webcast that we'll be doing. We'll be doing a live webcast once a month, and it'll be in this type of format. We're going to set it up so that no matter where you are, you can collaborate and interact with us in this type of fashion, okay? Before you go to the webcast, there'll be a flipped classroom that's already built. So it's got tons of content with really great high-yield pediatric resources, CPS statements. We've gone through and curated the content so it would be very quick and efficient for you to go through. Not read this chapter in a textbook, but here is the guideline at sick kids that we use to treat symptom X. And these are the key points of that problem that we want you to know. Okay, so that's all curated there for you. We're also going to do case challenges every month that we then take up during the webcast. Okay, so if you go on right now, sign up and go into the blog, you could read this case and fill it out, and you'll win a $10 Start Safe card. I'll just mail it out to you. So hopefully that helps get people involved. And this one's pretty easy because we just talked about this case.
Please don't get it wrong.
So yeah. Anything else?
So that's the website up there. We'll also tweet it out to CAPA to retweet for all of you Twitter people like me. The first live broadcast right now is tentatively scheduled for November 20th, I believe. So keep that in mind. What time?
So in the mornings, which is interesting, maybe we have to change it because of the West Coast. I didn't think about that. But at 9:30 Eastern time. So we can chat about moving the time around, so we're really flexible. We're also really flexible on the topics we're covering. We figured work and breathing would be a great first topic coming up now. But we've got burn care, we've got sepsis. What else do we have covered off?
We have a lot of basics. We have like otitis media and things like that as well. So, so lots of primary care things. If you're not in an emergency department, this is also definitely something I would say check out.
Yeah, any question?
I have two questions. One, the live podcast, like if you can't get on at the live time, is it gonna be recorded so we can watch it at another point?
Exactly, yeah. So as we record, or as we do the sessions, we'll have a video archive so that you can skip through it if you want
And
to.
the second question, does going to the live webcast or going onto the website and reading those things, does that count towards their CPD?
Wonderful question. So I'm working on that right now. I'm in the process of going through the Royal College's self-accreditation process. So it's pending. Hopefully in the near future, it will be available for Section A credits. So in the near future.
Yeah, so we expect within 2 months, we'll probably.
Yeah.
And you'll just send out or put it up on the website or something saying like it's now.
It's now accredited.
Yeah, exactly. Yeah, we'll let you know. We'll tweet it out.
Yeah, we'll tweet.
Sorry.
Yeah, you should follow us.
Any other questions at all?
Do we have a formulary on it?
So there is a Lexicon app that our sick kids formulary is linked into. I think there might be a fee. Like we have it because there's a code. You don't have it?
I do have it. I do have it. I don't know if they can get it though. I'm not sure.
Yeah. I think there's a fee for it. It might be hefty. I think it's like $400 a year, potentially. If you email Jordan, though, we can email you back, either maybe with a code or with like a solution on how to get it. So we can figure that out. Yeah.
One last thing, at the end of, on your app, when you're kind of going through this conference session, there is a part to kind of rate us and comment. We really do appreciate everybody taking some time to fill it out. Comments are appreciated. We are building this program on your feedback as well. So anything you want to really hear about, please let us know.
Yeah, and so the webcast sessions that we've come up with a bunch, we've got guest speakers across the hospital that'll come and teach you their like expert opinion on the matters. But basically, if you tweet us or send an email and say, this is what I want to learn about, we'll just make it happen. So it's really about tailoring education for physician assistants across the country so that we can sort of improve pediatric healthcare. Okay.
Thanks.
That's it. Thanks, guys.
Thank you, Devin. Thank you, Jordan. On behalf of CAPA, in lieu of gifts or honorariums, CAPA is a donation.
Awesome.
Esquimalt Military Family Resource Center, and the Victoria Native Friendship Center. So thank you both
That's awesome.
for your presentation. Awesome, well done.
Pleasure.
And like Jordan always talks about, he's on Twitter all the time. Follow him, check him out, and be jealous of his spoken skills because he gets to do it.
Yeah. There are live focus rounds that are also free to attend for PAs that are broadcast every week. They are Wednesday mornings. Check them out. They will also be on that website if you go to the main kind of page of it, but they're in the PEN network. So
And we have POCUS electives and whatnot that you can inquire about. So just let us know. We can sort things out.
yeah,
Okay.
come do ultrasounds.